Ebola virus. Ebola virus, a notoriously deadly virus that causes fearsome symptoms, the most prominent being high fever and massive internal bleeding. Ebola virus kills as many as 90% of the people it infects. It is one of the viruses that is capable of causing hemorrhagic, bloody, fever. Epidemics of Ebola virus have occurred mainly in African countries including Zaire, now the Democratic Republic of Congo, Gabon, Uganda, the Ivory Coast, and Sudan. Ebola virus is a hazard to laboratory workers and anyone who is exposed to it. The Ebola virus gained widespread attention in the fall of 2014 when an outbreak in West Africa became the largest outbreak reported in history. In this outbreak, an imported case from Liberia and associated locally acquired cases in healthcare workers were identified in the U.S. Infection with Ebola virus in humans is incidental. Humans do not carry the virus. The way in which the virus first appears in a human at the start of an outbreak has not been determined. However, it has been hypothesized that the first patient, the index case, becomes infected through contact with an infected animal. Ebola virus is transmitted by contact with blood, feces, or body fluids from an infected person or by direct contact with the virus, as in a laboratory. People can be exposed to Ebola virus from direct contact with the blood or secretions of an infected person. This is why the virus has often been spread through the families and friends of infected persons, in the course of feeding, holding, or otherwise caring for them. Family members and friends would come into close contact with such secretions. People can also be exposed to Ebola virus through contact with objects, such as needles, that have been contaminated with infected secretions. The incubation period, the period between contact with the virus and the appearance of symptoms, ranges from 2 to 21 days. The initial symptoms are usually high fever, headache, muscle aches, stomach pain, and diarrhea. There may also be sore throat, hiccups, and red and itchy eyes. The symptoms that tend to follow include vomiting, rash, and bleeding problems that include bloody nose, epistaxis, spitting up blood from the lungs, hemoptysis, vomiting blood from the stomach, hematemesis, and bloody eyes, conjunctival hemorrhages. Then finally come chest pain, shock, and death. Ebola virus.